Hello everyone, welcome to Digital Health News and yet another episode of DHN podcast. Thane was once considered an extension of Mumbai, but no more. Today, Thane has evolved into a growing, dense urban hub with its own complex healthcare needs. With its growing population, growing is also the demand of new world-class state-of-the-art healthcare facilities. And to bridge this care gap, Krishna Institute of Medical Sciences has launched its new facility in Thane and opened its door to its patients, what they call as guests, from 1st of May. Joining us today is Mr. Saurabh Gupta, Regional Chief Operating Officer at KIMS Hospital and also the group in charge of new hospital commissioning. Thank you so much, sir. Thank you so much for joining us on Digital Health News and congratulations on the new facility. We will definitely come to that, but let me first start with your journey. Your journey in healthcare has spanned diverse roles and in different regions. What is your leadership philosophy, especially in a role as dynamic as Regional Chief Operating Officer for a corporate healthcare chain like KIMS?
So I think that is a very pertinent question, and I'll actually speak about my reason for being into healthcare. So actually the reason is quite personal, and I lost one of my dear ones due to pathetic conditions in a big hospital almost 23 years back. And that actually forced me to think something different and to do something different. And that is the reason I actually thought of coming into healthcare. And after running one of the biggest hospitals in the northern India during COVID, I can actually say that two professions. One is all the armed forces, and that encompasses everything, from paramilitary to, and the medical profession. There are actually two very important facets of any system, any country, and they work in tandem to ensure that people are safe, people are happy. So I'm actually very proud of what we all do, and we actually want to continue to do a meaningful difference in people's life. When it comes to leadership philosophy, I always believe in leading from the front and setting examples. I generally practice, management by walking around, telling people what to do, showing them, and celebrate success for the people as a team, and basically take not the blame, but try to solve the issues which have offered for the team so that they can perform. So as a leader, it's all about servant leadership. You are actually more of a facilitator to the people, to the doctors, to the care providers. You are not someone who will direct them to do something. It's about giving them a platform to perform. So that is my philosophy, and I think that has worked, and we work as a team. We work relentlessly to bring healthcare to the masses, and now we are actually at Thane and very excited about it because the type of response we are getting is unprecedented actually.
And coming to the big news, as you rightly mentioned, now you're here in Thane. This marks your first in the financial capital of India. And if I may say, this is your fifth hospital in Maharashtra and fourth location in the state. What is the philosophy, or I may say, what is driving the continued investment in this region from KIMS?
So I think KIMS works on very clear philosophies. One is affordable care, high-end cutting-edge services, which is in the reach of the masses. It's very clear. We are one of the best when it comes to the quality healthcare and the technology use. In fact, some of the equipment which we have at KIMS Hospital is not only world class, it is one of the first in India. But still we are affordable. So we are known for that. We are very ethical. When it comes to Maharashtra, I think Maharashtra is by and large the powerhouse of India. It has the largest GDP. But somehow the healthcare penetration in the entire Maharashtra has not been up to the mark. Despite the hospitals being there in the bigger cities, the concentration of hospitals, per bed, if you see, is actually much lesser than majority of the big cities like Gurgaon, Hyderabad. Like Bombay stands at around 2.1 beds per thousand population, which is actually way less than big cities like Delhi, Hyderabad, and all. When it comes to Thane, it's actually zero point 0.4, which is like way below any standards, and you hardly have any good hospitals here. You do have hospitals, but again, they do bits and pieces. Comprehensive services under one roof is non-existent, and majority of the doctors are actually on visiting model. So you actually do not have USPs, or you don't have institutes of excellence where a lot of academic work happening, cutting edge work, something which is new, novel. So that's what we plan to change, and we are excited to be in Hirandani estate, which is actually now becoming the hub of Thane, and we are here as a community hospital also. So we have already started our OPDs. Indoor is about to start. We look forward to actually having a very healthy Thane going forward. That has been our endeavor.
I would also like to touch upon the aspect, Thane, as you rightly mentioned, that is a growing hub, it's a growing urban hub, and the healthcare needs of this region are also evolving. People are demanding more state-of-the-art, world-class care. Instead of building from a scratch, KIMS this time around decided to acquire an hospital here. What was the thought process behind that decision? If you could walk us through that.
So actually the choice of building versus acquiring depends on many factors. So there are commercial factors and there are social factors. So the commercial factors are, you need at least 3 to 4 years to build a hospital. There are a lot of approvals involved. So you waste a lot of time. The other commercial factor is you do not have a lot of land available or the type of land parcels, because the land will be at the outskirts, and the commute will be difficult. On the other front, if you see the social factors, the more you delay, like 3-year delay or 4-year delay, you do not delay the hospital, you delay the healthcare services from where it is required. So people actually want services as of yesterday. We, in the entire country, we have dearth of beds, dearth of specialties. So actually we are delaying healthcare from the point, so if you acquire something, and it is also a function of what assets are available. So if there is a hospital if it's a building which was meant for hospital and which is in a good locality in the sense which can serve the masses, like the hospital we are sitting at, why don't we undertake it and rebuild it, because the turnaround will be very fast, like 1.5 years we literally turn this place around. So there are a combination of social and commercial factors, but I think to the benefit of the community, I think this was the right decision to be taken, and we are up now to serve Thane and nearby localities also. We actually look forward to even serving Bombay and other places, because the type of clinical excellence and technology KIMS will be bringing will be unprecedented.
People deserve the best of the care that they can get. But Mumbai Thane is also a very competitive region. You have many popular hospitals, legacy hospitals here. So what is your vision for KIMS, this new facility that will set you apart?
So as I said, we stand for cutting edge affordable care and to make a difference in the community when it comes to wellness. So hospitals may be there, but even if you open practically 3 more hospitals in Thane, they will all be full, because there is so much of dearth, and there are some programs which are totally non-existent. As I told, like for example, 10 years back, there was not even a successful liver transplant program in whole of Bombay and suburbs. Now it is there. But the heart and lung transplant program, we talk about that. We are known for that in Asia. We want to bring that to Thane. The neurosciences program, again, we have one of the best in India. So there are multiple things. The technologies are there. We recently unveiled India's first Tulsa Pro, which is non-invasive, basically treatment of prostate cancers and prostate. It's one of its kind. We plan to bring it here. We recently unveiled MRI guided ultrasound for tremors, Parkinson. Again, 4th machine in India. nowhere in Maharashtra. So such are the novel techniques which we have, and somehow people don't even know such technologies exist, and we actually want to offer such cutting edge medical care to people of Thane and Bombay, because when you have this level of technology, clinical precision, you actually save on not only lot of unnecessary probably surgeries or stay, you actually improve the quality of life, and that is the most important thing.
Mr. Saurabh, while talking before this interview, you mentioned the impetus on patient experience and excellence of care at KIMS. And digital transformation is the enabler that will help you achieve patient experience and excellence in care. Walk us through the digital technologies that you are implementing in KIMS Thane from day one.
So, you yourself said we actually see digital as a big enabler, and we are very clear that our doctors and the healthcare providers, they are actually our primary assets, and they are here to serve the community. So, how much we can use digital to make their life easy, to enhance their capacity, to improve patient experience, that's what we use digital for. We have few things which will be there from day one. So I think we are one of the pioneers in the smart beds dozy. So it's an AI enabled contactless platform which offers you host of benefits. So one is that you do not have unprecedented cardiac arrest in the hospital. It catches before that. So that is one thing which will be there from day one. We have tied up with Rapid AI, and our CT scanner is an AI-based CT scanner. So we detect these strokes much earlier and much precisely, so that you can actually completely reverse a stroke. We use Cure AI to enhance and basically look into the clinical precision for X-ray and other things. We are going for a AI-based 3D mammogram, which is actually coming from outside India. So that is one of its kind. So we do mix and match a lot of these AI-based tools. In fact, we have a host of around 28 to 30 applications. So we have a digital platform for everything. Like if some guest, we actually try not to call patients as patients, because they are guests in my home or my place who are unwell. So if any guest they have any issues, they can actually do it on HRX Central, which is a thing. We have our nurse call system is very different. It is a dial pad from where you can actually talk to the nurse. You can directly call an FNB supervisor. So there are a host of things in that. It's very customized to KIMS. So we actually plan to mix and match. We have host of digital features again, but the core will be our doctors who will be enabled by your caregivers and other staff for enhancing patient experience and provide good quality care.
I agree completely with you here when you say that to provide best of the patient care, the clinical side and the technology side has to work in the tandem, and that's when the best of the care will be provided to the patients. You briefly touched on artificial intelligence. I would like to elaborate a little bit on that, because since I believe 2024, we have been hearing a lot of buzz around artificial intelligence, and it will be wrong if we don't elaborate on that. What are the AI first facilities in KIMS Thane that you are going to introduce?
So actually, I have already spoke about it. So our CT scan is an AI based, which detects the stroke much faster in a much precise manner. The other thing is all the X-rays generally, all the images, chest X-rays, we have Cure AI, which is an algorithm which actually detects an abnormality. Now, you must have heard that for breast, mammography, if you have AI-based scan, the AI-based algorithms picks up the breast tumors much more in advance, at least 2-3 years in advance than a naked, eye by a radiologist. So, but the mammogram which we are going for is actually AI-based. So these are some of the things which we are using dozy. So we will get preemptive alerts if any cardiac event is about to happen. So as you have electrocardiogram, you have a bradykardiogram also. So it actually measures, contactless, what is the cardiac activity. So we would work on that. So there will be a host of things. Some of these things will not be visible to the guests, and some of them will be with the caregivers, but it will be well integrated into the system.
Right. When we integrate digital technologies, one of the challenges that many hospitals face is to get the clinical side also on board, on the same page with the newer technologies that they are integrating. How are you managing this challenge at KIMS, or do you even face this challenge at KIMS?
So everybody faces this challenge. This is again a life learning. I was part of one of the biggest hospitals in India with 1,000-bedded Medanta, Lucknow. So practically started that hospital and ran it through 3 waves of COVID. Now we work with the Ogneto, which is an AI-based speech tool, and actually it is one of the most successful tools because they work with us, they work with doctors. So what actually happened is that when they started, they were not very accurate, and we were also not very sure because when we spoke to the doctors, they were not very keen. The exact thing. They said, I have 80 patients. Who has time to speak? I'll better write, and that's what. And there's so many things available. They said, I'll still scribble. You get me something which is scribble based. So what we did is we identified people with very high volumes, and we said that they need some time, and if we can free up some of their time, that is what that will, not only enhance their personal life, but actually they will be our ambassadors. Right. So we actually worked with 2 of these doctors. One was actually the biggest nephrologist of that region, Dr. Sharma, and one internal medicine doctor. So they agreed somehow to use it. I said, you can literally throw it if you don't like it, but please use it. So they started using it. They found a lot of flaws, which got corrected because the team was there. And at the end, I think after 1.5, 2 months, they found that actually that particular piece is making their life much simpler. And that was the pivotal point. That was the paradigm shift, because that person or that doctor became our ambassador. Now somebody of his stature, then when leading from the front, telling that this is to be done, that completely changed, and then it started getting adopted. The other thing I want to touch, because you've noticed, we actually do a lot of environmental friendly stuff in our hospital. So we don't use these radiology films because they have a lot of ammonia footprint and they are bad for the environment. We have DICOM enabled paper. So if somebody goes for an X-ray or a CT, they will actually get a paper print, which is a medical grade paper. It is almost as good as a paper, film, but has almost less than 10% of the carbon footprint and ammonia footprint, which we use jute bags, reusable. We don't use plastic bags. So a lot of such things you will also see in our hospital, because now everybody talks about ESG, but yes, we have been doing this much before the ESG actually kicked in. So that is the thing.
Quite fantastic, because I think along with care and technology, sustainability is also the new frontier on which the hospitals have to deal with. Let me also touch upon the security part of it. Since you are using host of digital technologies and multiple apps, 30 as you rightly said, security becomes a very concerning aspect. In 2024 especially, the healthcare saw the maximum number of cybersecurity attacks. So while you are dealing with sensitive patient data, what are the cybersecurity arrangements or the facilities that you have at KIMS?
So there are 2 aspects of it. One is hardware and one is a software. When it talk about software, it does include the people, attitude and training. So this is something which is inculcated from day one in the staff, not to discuss anything about the guests, not to discuss in lift at places which are public, and be very discreet about the information. So we generally don't write patient names everywhere. That is what. The displays are digital. We don't have so it keeps on changing. On the hardware part, we actually have an expert which controls our security, SCO, Security Control Center, Security Control Operations, and we have in-house servers which are properly firewalled, and also we have cloud operations with remote backup. So, if anything goes back, we have a backup. So, I think it's in good hands. We follow all the protocols. Our firewalls are very strong. And we keep updating the definitions as and when required.
What are your plans for telemedicine and virtual consults?
So I think it is already there, virtual consults. It's not a big thing. It became live at the time of COVID. There were a lot of consults happening, and still now a lot of follow-up consults happen. So those will be live. And the other thing is on the remote monitoring. I think Dozy has an extended home version. So we will go for that. So we do look forward because we do not just want to serve Hirandani Estate and Thane. We are looking at, Ulhasnagar and places where there is minimal, healthcare available, minimal penetration of healthcare. So we have latest equipment which can be integrated, and we will actually look forward to having some EICUs and other things in the future.
Beyond tertiary care, do you have any plans to, go into the home healthcare arena?
So we will have home healthcare. We will have a home healthcare through a partner. And a hospital cannot just singularly provide tertiary healthcare. So in India specifically, you need to work across all the spectrum. So you need to be in wellness, you need to be in primary, secondary, tertiary. So we will be doing all. And this hospital actually stands as a very unique place, which is inside Hirandani Estate. So we also are a community hospital for them. Despite being a quaternary care tertiary center, we are also a community hospital. So we need to be, very strong on the wellness part of that, as I said. And we are already working with, there are almost 135 societies in Hirandani Estate. Yes. So we are working with them to actually, have some wellness packages for them. And then we are, in case of any untoward incidents, we are always there. By the way, one more thing I must tell you, we are actually one of the first in Maharashtra to launch 5G ambulance, and it's not a CCTV ambulance. Yeah, so you will see the announcement very soon. But I am just telling you preemptively that we are the first actually, and it's a 5G enabled ambulance which live transfer the data, patient vitals, to our ER, and they can actually decide right there what needs to be done with the patient. Because what happens is when you talk about Bombay especially, sometimes the ambulances are stuck in traffic. Yes. You cannot reach in time. So, telling things on phone and, just a CCTV might not actually tell you the right condition of the patient. But the ambulance which we have tied up with Medulance, it's a Delhi-based company, but they are actually the first in India to have 5G enabled ambulance. So now we will actually be deploying ambulances from them, and there will be pure 5G ambulance where live patient vitals will be transferred to our ER, and they will be in touch throughout when the patient is being brought to the hospital.
Thank you so much. I mean, that's fantastic, and congratulations on that achievement. Well, with that, we have come to almost at the end of the interview. But as we end, I would like to ask you, what is that one thing that excites you the most about this new chapter? I believe you have been traveling to Mumbai and to Thane for the past 1 year, as you rightly said, and now you have moved here. So what are those things that excite you both personally and professionally? And what would be your message to the people of Thane or to the people of Mumbai MMR region?
So I think the most important thing, or the thing which excites me, is the ability to have a meaningful difference in people's life. And that is what excites me, because ultimately, if you see two happy guests getting treated and they leave your hospital with a smile, nothing beats that actually. That feeling you get, and I have personally felt that feeling. People are coming in distress and you are able to, especially after running some COVID hospitals, when they leave, and it's almost close to a miracle, and then they smile and say thank you. Now that moment I cannot just express, but you can just feel that. So I am really excited to actually make some meaningful differences in people's life. The message to Thane and MMR region is that I wish that you remain well, and we will ensure to actually have packages and a lot of screening programs. But if God forbid there is anything, we are there. You will be treated as a guest in my own house, and we will leave no stone unturned to make your stay comfortable and to send you home healthy as soon as possible.
Thank you. That's a wonderful message to the people of Thane and MMR region. Thank you so much for having this conversation with us on Digital Health News. And congratulations once again on this wonderful facility. Thank you so much.
You're welcome.